Good morning. My name is Loretta Konadu Nyarko, a medical officer at Superior Medical Center, and today we are going to talk about breast cancer. So, what is breast cancer? Breast cancer is abnormal growth or proliferation of the cells of the breast tissue that can spread to other parts of the body if not detected early or treated. Breast cancer continues to be of public health importance because it has been shown to be the leading cause of cancer death, especially in women. So it is very imperative for every woman to know about breast cancer and how it presents. So what causes breast cancer? The exact cause of breast cancer is unknown, like other forms of cancer, but there are some factors that have been shown to predispose an individual to the development of breast cancer. So we are going to go through some of these factors. The first one is the family history. Research has shown that people with family histories of breast cancer have a higher risk of developing breast cancers as compared to people without family histories of breast cancer. So the second one is genetic predisposition. As we are developing, there are some abnormalities or mutations that occurs in an individual that predisposes that particular individual to developing breast cancer. The third one is sex. And being female predisposes an individual to the development of developing breast cancer than males. It has been shown that breast cancer is about 100 times more common in women than in men. The fourth point is age. As we age, the ability of the body to repair itself after damage is reduced, hence predisposing an individual to developing cancers, of which breast cancer is among. Another factor is infertility, nulliparity, or women having their first child after the age of 30 years. Research has shown that these women belonging to these categories have a higher exposure to estrogen that increases their risk of developing breast cancer. So now we go to the presentation of breast cancer. How would I know if I have breast cancer? So sometimes breast cancer can be asymptomatic in the initial stages. So you might not feel anything, you might not see any breast changes. As time goes on, you might see changes like dimpling on the breast. You can see nipple discharges, especially if it's bloody, and then there can also be a feeling of a mass, a painless mass in the breast. And there's also something called peau d'orange. Peau d'orange basically means peel of an orange. So the breast resembles a peel of an orange because of the indentations that is similar to that of an orange peel. Then we move to investigations that's done when we suspect breast cancer. So the first one is a breast ultrasound, which is usually reserved for the younger women. We have the mammogram, usually for the elderly women. We have the MRI of the breast, which gives us a detailed information of the breast to let us visualize the breast very well. And also we have biopsy. So sometimes, especially if you present with an ulcerated breast, the doctor will take a small sample of your breast tissue, send it to the lab for histopathology, and then tell you whether you have cancer or not. So next, we come to the treatment of breast cancer. There are several modalities for treating breast cancer. So like I said earlier, after the investigation, the next is staging. So usually your doctor will stage you to know the outcome of the disease. So usually we stage to know the outcome or prognosis of any cancer disease, of which breast cancer is among. So stage 1 being a mild form, and then stage 4 being a severe form, which means that the cancer has spread to some parts of the body. It is very important to detect breast cancer early because research has shown that the survival rate of breast cancer in stage 1 is about 90%. So that's why you usually hear us say early detection saves lives. If we are able to detect the breast cancer early, the survival rate is markedly improved as compared to patients who present later stages. So now we move to the treatment modalities. So there are several forms of modalities that are done for breast cancer. So we have the surgical modality, we have the chemotherapy, we have the radiation therapy, and then we have the hormonal therapy. So with the surgical modality, we can have the lumpectomy, which is taking part of the breast tissue or the part of the breast that is diseased away, or we can have the mastectomy. So mastectomy means taking the whole breast away. The second treatment modality is chemotherapy. So what chemo does is that the chemo drugs helps prevent the growth of the cancer cells or kills the cancer cells. We also have the radiation therapy. So with the radiation therapy, we use radiation to either destroy the cancer cells or limit or prevent their growth. And we also have the hormonal therapy. So after the investigation, your doctor will assess to see whether your breast cancer an individual has responsive to any of the hormones. So if it's responsive to any of the hormones, we then use that hormones to try to suppress the growth of the breast cancer. So basically that is all about breast cancer in summary. Like I said earlier, early detection saves lives. If you be able to detect the breast cancer early, the survival rate is really improved. That's why we advocate for monthly self-breast examination for every woman to be able to pick up these signs and symptoms I've mentioned earlier. Report to a health facility for treatment. If you have any questions or any comments, you can visit our facility at Superior Medical Center at Parakuo Estate, or you can comment under this video. Thank you.